chat box, and then we'll get to answer all of them. So happy World Mental Health Day again, and welcome to our presentation. We hope you have a fulfilling time here. We'll go straight to the point even as we start. Okay, so what is mental health? According to the World Health Organization, mental health is defined as a state of well-being in which every individual realizes his or her potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. How many times have you thought, well, I'm physically fine, but have you asked yourself if you're mentally okay? Okay, it's a part of life that we most likely neglect and don't know how to go about it. But one part that always gets me um, intrigued is the last part of the definition of mental health, where it says you are able to make a contribution to your community. Okay, so what are some of the major myths that we have in mental health? We'll just look at a few of them and then we'll go along from there. One of the myths is people with mental health needs, even those who are managing their mental illness, cannot tolerate the stress of holding down a job. Yeah, how many times have you thought that, well, if somebody has a mental health issue, he would not be able to make a living, like have a job and make a living. So we have personality weakness or character flaws cause mental health problems. People with mental health problems can snap out of it if they try hard enough. Yes, we've been told that very well, that if you're having a particular mental health disorder or mental health challenge, you can snap out of it by yourself if you try hard enough. Number three is mental health is for crazy people and are not expected to be involved in the society. Yes, the stigma of mental health is really there, and most of the times we feel that people with mental health issues are crazy, and of course are not expected to have a life in our society today. Number four, we have people with mental health illness are violent and unpredictable. How many times have you unconsciously walked close by somebody who has a mental health issue and you're looking at your back, you're looking at your side and wondering, well, what is he going to do now? Is he going to hit me with a hammer? Is he going to chase me down the road? We always think that people with mental health illness are violent and unpredictable. But then when we get to the facts, I think you'll understand better. Number five says, if I can't sleep for 2 weeks, it means I am hardworking and should be rewarded. How many times have you actually told yourself that, oh, I can't sleep, I've been working so hard, and you feel it's a normal part of life to not be able to sleep for 2 weeks? More like you can reward yourself for not being able to sleep for 2 weeks. So that's quite a myth about mental health and should be looked into. Number six says, if I get angry and when I'm angry I flare up or break something and say, but well, it's part of life. How many times have you done that? You've seen people throw things at each other, they hit people anyhow because of anger issues, and we think, well, it's part of life. The world is broken. Nigeria is broken, and that's what we times, but it's not that way. If I get angry and when I'm angry I flare up or break something, it's it's part of life. Kai, no, I don't think so. Okay. Number seven says, I am losing interest in almost everything because of the traumatic experience. I was told to grow up and be strong. How many times have you actually heard that? That you're losing interest in almost everything because of a particular traumatic experience, and then you were told to grow up and be strong. Sometimes we think we could handle it on our own, like I said earlier, but sometimes we need serious help. Another myth is, I think only about the negative of events and never at what positives can come out of it. How many times have you looked at yourself or know somebody who is always thinking about the negative but never thinking about the positive? Okay? We most times don't even think about the positive because we say, well, we're being over realistic about things. But we think about the negative so much that it gets us quite depressed. And sometimes we tell ourselves, well, I rather think about the negative than think about the positive. So that if the positive does not happen, at least I've always thought about the negative. But that's not a healthy way of living. Another myth is mental health is always about people who are challenged. Okay, it's not for people who are healthy and strong physically. It's only for people who have one thing or the other. Maybe their hands are cut off, their legs are cut off, and they're struggling to live. But it's not for people who are basically whole. Okay, after looking at the facts, let's look. Sorry, after looking at the myths, let's look at the facts right now about mental health, and then we'll just run through them briefly. Mental health doesn't mean absence of mental illness. It is as important as physical health that needs to be checked. Have you heard that before? When last did you check your mental health? Just like physical health, mental health is also on the spectrum or continuum of poor to optimal. Your mental health could be at its worst or its best. And you could check that. Okay? You could check the status of your mental health to know whether you are at its worst, it's at its worst, or at its best. With physical health, some days we initially feel stronger and more energetic than others. Similarly, some days our mental health is worse than others, and that is a natural part of being human. Okay, we're not saying you're supposed to be happy your whole life. We're not saying you're supposed to wear a smile from morning to evening, 365 days in the year. But there are times that you may feel tired, grumpy, sad, angry, anxious, depressed, stressed, or even happy at a point in time. These are normal human emotions and are not on their own signs of mental health. Okay? So don't feel that, oh, if I'm sad today, that means I have a mental health issue. No. Someone living with a mental illness can be experiencing optimal mental health at any point in time, while someone else can feel sad or low even in the absence of mental illness. So all it's trying to say is that it is part of life to feel tired, grumpy, sad, angry, and all of that. It is part of life. But then when it gets too much, then and it interferes with your functioning in the society, then you have a problem. Okay, so long as you're not functioning well and making a contribution to the society, your mental health is on the poor. The vast majority of people with mental health problems are no more likely to be violent than anyone else. Okay? Most people with mental illness are not violent, and only 3% to 5% of violent acts can be attributed to individuals living with a serious mental illness. Okay? So, we said one of the myths was that mental health, the people who have mental health challenges are very violent. And from one of the facts here, it says that just 3 to 5% of violent acts can be attributed to individuals living with a serious mental illness. Okay? In fact, people with severe mental illness are over 10 times more likely to be victims of violent crimes than the general population. Hundreds of millions of people worldwide are affected by mental, behavioral, neurological, and substance use disorders. Okay? So we'll just look at some numbers right now. For example, estimates made by World Health Organization in 2002 showed that 154 million people globally suffer from depression and 25 million people from schizophrenia. 91 million people are affected by alcohol use disorder and 15 million by drug use disorder. A recently published World Health Organization report shows that 50 million people suffer from epilepsy and 24 million from Alzheimer's and other dementias. Now, look at the numbers again. 154 million people globally suffer from depression. That's quite a lot. We'll move on. 55% of persons with mental disorders have little or no awareness of their illness and so do not seek help. Think about that. 55% of persons with mental disorders have little or no awareness of the illness itself. And of course, if you don't know, you wouldn't seek for help. Now, 45% who acknowledge that they need treatment, that means they are aware of their illness, but still were not receiving treatment. Why? We'll look at some of the reasons why. It says 32% wanted to solve the problem on their own. 27% thought the problem would get better with time itself. 20% admitted it was too expensive. 18% were unsure about where to go to for help. 17% felt help would probably not do any good. And 16% health insurance will not cover treatment. Okay? These are some of the facts why people who know they have problems cannot even access treatment. Okay? In addition to the above figures, many other disorders affect the nervous system or produce neurological sequels. About 877,000 people die by suicide every year. 877,000 people die by suicide every year. Okay? Another fact is that 1 in 4 patients visiting a health service has at least one mental, neurological, or behavioral disorder. But most of these disorders are neither diagnosed nor treated. What if we treated every one person who had a mental health issue instead of just treating the physical part of it? Okay? And so we'll move on to assessing mental health. My colleague will take it from there.
I still remain in AIBETH. We've heard about the myths and the facts about mental health. Now we'll talk about assessing mental health. Assessing mental health has been a global issue worldwide, especially in developing countries like Nigeria. Amidst the corona pandemic, we are being warned of a second wave of mental health problems that threaten to overrun an already weakened mental health service. Due to uncertainty of COVID-19, people have experienced trauma, anxiety-related issues like panic attacks, compulsive obsessive disorders, in which we have aspect of use of hand sanitizer, repetitive use or washing of hands, and issue of social isolation. In that aspect, people have experienced frustration, aggression, trying to cope with the life changes, and we had increase of domestic violence, substance use. As we emerge from this crisis, some people may need special help with treating mental illness. Everybody can benefit from strategies to improve mental health. Mental health versus mental illness. Mental health are expressions we use almost every day, but it might surprise you to know that people still have this misconception about mental health. Mental health and mental illness are not the same thing. You can have poor mental health in the absence of mental illness, adapted from care. People sometimes substitute mental health for mental health conditions like anxiety, depression. But differentiating between poor mental health and symptoms of mental illness is not always clear-cut. When poor mental health has a sustained negative impact on someone's ability to work, have meaningful relationships, and fulfill day-to-day tasks, it could be a sign of mental illness requiring treatment. In this aspect, what they are trying to say here is that mental health has to do with wellness rather than illness. Rather than saying what is the problem, we say what or what's well or what's going well. We have positive mental health. Positive mental health and well-being is a combination of feeling good and functioning well. There are important components that will check that is associated with positive mental health. Experiencing positive emotion, this has to do with our happiness, our life satisfaction, good mood, and then feeling satisfied with life. Then we have having a positive relationship. We trying to maintain a good relationship with our family, with our friends. This entails feeling love and being loved. In that aspect, we cannot give love if we don't even love ourselves. So it is advisable that we love ourselves as an individual. We need nobody to just love us or expect people to love us, but when we love ourselves, we can share such love out to other people in need. Feeling engaged with life. In this aspect, this is working productively and fruitfully, doing something for a purpose, and then at the end of your hard work, you expect an end result. Then living meaningful and purposeful life. That is the essence of living. There is no purpose, there is no existence if you don't have purpose for living. In this aspect, this entails our passion, our goals, our reason for existence. So we have our vision, our mission, we plan and how to implement to achieve such purpose in life. Resilience. Being the fact we are being stressed, we have life challenges, it doesn't mean that we're not going to find it difficult. But here they're trying to tell us that after such incidents, we should bounce back. That's an ability to cope from stress, life challenges. Definitely we'll experience traumatic experience. We'll have so many things that we've never expected, but things will be hard for us. But here they're trying to tell us that we should try as much as possible to cope with such events. Optimism. This has to do with our positive mindset, which it says we can do all things. It has to do with willpower, it has to do with peace, it has to do with hope. Staying positive even in the face of challenges and hardship. A sense of accomplishment. After all work, after all plans, at the end of our life, we feel all the tasks we've planned for, we're able to achieve it and it's fruitful. And there's this sense of accomplishment that we get that brings about happiness. Vitality. This is the feeling of energy, being active. And these are things we need to do our day-to-day activities. That's the energy we need. And the more we have such energy, the more stronger we have or we become. How to improve mental health? Our mental health is shaped by social, economic, genetic, and environmental conditions. To improve mental health within society at large, we need to address the social determinants of poor mental health, including poverty, economic insecurity, unemployment, low education, social disadvantage, homelessness, and social isolation. That has been one factor that we face during the pandemic in aspect of social isolation. It has disconnected people, brought about loneliness, and in such aspects, it is expected that people to adjust to these new life changes. We need to build that resilience. We need to fight back. We need to reconnect with each other in order for us to maintain and improve a good mental health state. Positive mental health involves being able to cope with the challenges of life. On an individual level, there are steps we can take to optimize our mental health state. But first, we need to identify our existing support network. In this aspect, if there's one thing that has kept Africa together, united, is the extended family psychosocial support in which we look out for each other, we care for each other. And in that aspect, with the social isolation, it has affected us in that aspect, which has brought about disconnection, it has brought about distrust because everybody is scared of the COVID-19 virus. We have social networks at our disposal, but accessing it has been an issue. Choosing the right social network is another issue. One best social network that we have in our disposal is the mental health facility, mental health care, mental health professionals, whom we can seek help in order for us to cope with such life challenges. Also, we have our religious institutions where we can be encouraged in terms of our faith, but it's so unfortunate that it is doing more harm than good to people because we've had so many mental health issues as a result of religious belief in terms of delusion. All those things are contributors to mental health issues. Then also coping strategies that we can use or that we've used in the past. From past experience that has been successful for us can be used in order for us to also cope with life challenges. There are small things we can do to improve our mental health and help us to cope in tough times, such as helping others. This is also giving back to the community as we heard about from our definition. They said you've not started living until when you started impacting your life on other people. There's this ripple effect that we get while helping other people. We get that same happiness back to us because you will be okay that you are helping another person or another person is smiling because of you. Finding a type of exercise or physical activity you enjoy, like yoga. There are so many benefits associated with exercise in terms of reducing the risk of coronary heart disease or stroke, also reduces the pain or physical body pain. It also helps us to burn calories that might be harmful to our body. It also increases and boosts our mental health state. In that aspect, it also helps improve our sexual life. Getting good sleep is another good way to improve our mental health because it helps to revive our worn out tissues, cells, and also nerve cells that have worn out or can also regenerate. It is advisable that we have 7 to 8 hours sleep a day. Eating healthy food. Sometimes we eat food that are very harmful to our system. We need to watch what we eat in terms of too much of carbohydrates or sugar in our system is not good for us. But we can eat foods that are very rich in minerals and iron, in fiber that can help boost the blood flow in our system. Connecting with other people, building and maintaining positive relationships. With the post-pandemic, we've had issues of social isolation, which people have disconnected with each other, with family, and then because of the fear of the uncertainty, people have become paranoid, that is, suspecting each other. We become so suspicious. You see a husband being suspicious of his wife, whether she's infected or not, or you also not trusting your friends whether they have the virus or not. And then in that aspect, there is need for us to reconnect to each other in order for us to maintain that positive relationship, to have that bond that we once had before the crisis of the COVID-19. Then learning strategies to manage stress. That can be done as a coping skill in order to manage stress in life. Especially we have like stress management, resilience building, emotional intelligence, interpersonal communication skills. These are skills that we can learn in order for us to help and cope with challenges in life. And that can be learned from mental health professionals, which AIBETH Center is also here for you. Having realistic expectations. No one is happy and positive all the time. We can be optimistic and pessimistic. In that aspect, We expect the worst and we expect the good, so that anyone that comes our way will not take us by surprise. Because once we are aware of such issues, we've conditioned our mind. It won't take us by surprise because we are already ready for it. Cancer reacting negative or overcritical thinking. This can result from traumatic experience, negative events, but that can help in aspect of coping with these things through use of thought stopping or challenging negative thoughts, and that can be used with through behavioral and cognitive and behavioral therapy. In that aspect, only a mental health professional can help in that aspect. Doing things you enjoy that gives you joy. This will go back to our vocation or occupational choice. In that aspect, we need to choose a career which we are passionate about. Because when we don't choose a career that we are passionate about, no matter how much we earn, it will be our major stressor. Come to think of it, you are doing a job you're so passionate about, there's this satisfaction you get. And having an additional incentive and you're being paid for what you love doing, it comes with overwhelming joy. Barriers to mental health. Due to the complex nature of psychological disorders, successful treatment often requires regular access to mental health care professionals and a variety of support services. Unfortunately, mental health care services are often not available or are underutilized, particularly in developing countries. Even when we have it in our own disposal, we cannot access it. Why? Because poor education. In developed countries, the treatment gap, the percentage age of individuals who need mental health care but do not receive treatment ranges from 44% to 70%. In developing countries, the treatment gap can be as high as 90, which is a very bad one. Common barriers to mental health care access. We have limited availability of medication and health professionals. We have very short number of health professionals, and mental health medications are very scarce when it comes to treatment for patients. Then we have limited affordability, especially in developing countries, the economic hardship, the rate of poverty, how many people can afford mental health because mental health is expensive. Policy limitations. Mental health is not covered with any insurance policy. Policies are made that don't even incorporate mental health in it. Then we also have lack of education. People are not aware. People have little information about mental health. And for that reason, they don't know the significance and the importance for them to come for mental health check, just like they do for physical health. We have issues of stigma, stereotyping, labeling, which has been one major crisis or problem that we have with people suffering from mental health conditions. Cultural and religious perspective on mental health has been another major barrier. Due to our belief system, we feel that people with mental health issues are possessed. And for that reason, there is no need for them coming for mental health treatment because they feel there's nothing like that, but rather people are possessed in that aspect. Incorporating mental health to the system. The World Health Organization cites a global lack of comprehensive mental health policies, which are crucial for implementing and coordinating mental health care services as a key barrier to public access to mental health. Nearly one-third of all countries and almost half of all African nations have no comprehensive mental health care policy or plan. Among countries with mental health care policies in place, approximately 40% have not been reversed since 1990 or repeated. and do not address recent development in mental health care. Furthermore, 22% of countries do not have laws that protect that offer protection of the human and civil rights of people with mental health illness. That's where we have rise in aspect of stigmatization, labeling, and stereotyping. In many low and middle income countries, the localization of mental health care and resources in large cities has also been cited as a key barrier to providing mental health care to the entire population, and geographical decentralization has been recommended to improve accessibility to mental health care in non-urban communities. This is because mental health facilities are centralized in the urban areas, in the metropolis. Little or none that we have in the grassroots communities, in our local communities. So here they are trying to say that such should be decentralized to local communities so that mental health services can be accessed by people at the grassroots level. In many low and middle income countries, the high cost of psychiatric treatment, often due to high medication prices, poses significant financial barriers to patient care, especially poverty in Africa. In addition, psychological disorders are not covered by insurance policies in many countries, making mental health care unaffordable for people. By insurance policies, it can help to subsidize mental health prices and services for people to find it easy to access mental health care. How to know if you need help? Regardless of whether you are experiencing a mental illness, everyone has a right to optimal mental health. The suggestion on how to improve your mental health can help everyone improve their mental health and well-being. And help is available if you are not sure how to get started. However, when this stress and poor mental health is interfering with our daily life, work, study, or relationship, these suggestions may not be enough by themselves, and additional individualized treatment may be needed. If the answer to "Are you okay?" is no, or you or your loved ones need help, reaching out to AIBETH Center, which is one mental health center located here in Jos for mental health well-being check, is an important step because it's okay not to be okay. In terms of more inquiries, and you want to get more information about AIBETH Center, you can locate us through this address on your screen. Thank you very much for your time.
All right. Thank you for your time. We will take questions right now. And if you have any questions for us, you're free to ask, and then we'll answer your questions just as time goes. Okay, so we have a few questions here which says, what is the difference between mental health and mental illness? Okay, so I'll leave my colleague to answer that.
So in aspect of mental health and mental illness, like I earlier said, mental health has to do with our wellness rather than our illness. And from our definition that we got, they said mental health is the state of well-being in which an individual maximizes his or her own potential, can cope with stresses of life, work productively and fruitfully, and also contribute to the community. Mental health has to do with your state of being, which has to do with your cognitive, your emotionally, and then also socially in that aspect. So if you check all those spectrum, it has to do with all those healthy behaviors that we do. But mental illness has to do with conditions that affect us, that leads to aspect of distress, that will stop us from working productively or fruitfully, also affects our relationship, and then we can our potential in that aspect. So mental health has to do with wellness rather than illness.
Right. Our second question says, can anyone diagnose mental health illness, or it has to be a professional? Now, you anyone can probably know some signs that lead to mental illness. Okay, you could point out some signs that probably you're suspecting that, well, this person has not functioned well for some time. Okay, and then but to diagnose mental illness, it has to be a professional clinical psychologist that would run some tests to diagnose you with probably in mental illness or of a sort. Now, what I mean by a layman can actually see some signs, something like you notice that somebody is not going out of the house for probably 1 week and is always locked in the room. You could see signs of mental health issues, or you cannot diagnose it yourself. It has to be a professional to do that. Okay. The next question says, how can one have an impact on the situation of mental instability in the country?
Just like what we're doing now, through psychoeducation, awareness, advocacy, and then also sensitizing people about mental health, because there's always this misconception and misunderstanding about mental health, an aspect of stigmatization based on the myth and the fact that we spoke about. People feel that once you have mental issues, they feel you're crazy or you cannot do anything productive in life. But through psychoeducation, we can enlighten people to know what mental health is all about, how they can affect mental health and seek for help, and then it is curable, it is treatable, and then through mitigation and intervention, one can come back from any mental dysfunction or condition.
All right, so just wait for about a minute for anybody to also send in questions. But just like very important and nice if you keep building tech at ABETH Center. You could also advise someone that you think is struggling through a particular mental health challenge to check his or herself so that we reach the optimal. Remember that the definition of mental health doesn't just end at being okay, but also contributing positively to the society.
Also, in aspect of mental health, healthy mental health or positive mental health improve our learning abilities. It also increase our good relationship, and then all aspects of productivity when it comes to workforce. But in aspect of mental illness, it brings about distress that reduces our impact in work, also unable to maintain a good relationship, and then isolate ourselves from social activities. So mental illness has to do with loss of interest on previous pleasurable activities. Thank you.
All right, the absence of none was nice having some time with you today, and we hope that you actually check your mental status today and even advise someone to help someone to go through a particular therapy to be able to help the person. See you next time, and it was nice having a wonderful session with you today. Thank you, and bye.